We're going to keep beating this horse a little bit, and we're going to talk about kind of successful tips and tricks for your away rotation. Some of these things have been mentioned. This is not to be redundant. This is to help you to understand that this is the most important part of your application and you putting your best foot forward. So this talk, How to Succeed on Your EM Sub-Internship, could just as easily and probably more appropriately be called How Not to Screw Up Your EM Sub-Internship, right? So this is a quote from a paper that was published in 2000. When 4 weeks of your time might dictate the next 3 to 4 years of your life, you want to make sure you cover all your bases. And Dr. Story talked about this, that this away rotation is really a 4-week interview in a lot of senses. This is the paper that it referenced. This was a survey that was sent in 1999 to all program directors and asked what are the top components that they look at when they evaluate medical students for matching into residency. And number one was the score on their emergency medicine rotation. For those of you interested in scholarship, this is how you do it. This is the exact same study, repeated 18 years later. It was published in 2018, and it reinforced this idea, right? So the number one, again, criteria for evaluating medical students was grade on their EM clerkships, and they're slow. So the bulk of this talk is really some general tips and tricks. This is not rocket science, and I guarantee you that all of you will sit in this room and you'll roll your eyes and you'll say that this advice does not pertain to me, I would never do those things. And yet medical students across the country every month continue to fall into these traps and shoot themselves in the foot. And so I encourage you to try to really internalize some of this stuff. We talked about how anxiety-provoking this rotation is because it means so much, and it may expose parts of you and your stress and anxiety that you don't normally show, and you need to be mindful of those and control those. So the way the advice in this talk was gathered was somewhat of my personal bias. So just again, I'm an associate program director for the residency program at Denver Health. I've worked with hundreds and hundreds and hundreds of medical students. I've read hundreds and hundreds and hundreds of SLOs. So I feel like I have a fairly good idea of where common missteps are. Additionally, when I first put this talk together, I surveyed our senior residents who work with medical students within our own institution, and also reached out through the Academic Life and Emergency Medicine Chief Resident Incubator and Faculty Incubator. So really pulled a lot of opinions and pulled those things that kept coming up and up and up again. Just for reference, this is the majority of this talk is available on a post through ALEM. You can just search my name, Sungar, or that QR code will get you there. So we're going to start with things to avoid. And again, some of these things have shown up. But number one is don't be late, right? I had a football coach in college who said if you're not 10 minutes early, you're 10 minutes late, right? And despite the fact that bends the space-time continuum, you need to be early for all of your shifts, right? You guys worked hard in high school, you worked really hard in college, you took the MCAT, you've worked really hard in medical school, you've devoted thousands of hours to be able to sit in this seat and potentially match into an emergency medicine residency program. Don't show up 5 minutes late and destroy all that. It's not worth it, right? Emergency medicine is a specialty of shift work, and by showing up late, you're demonstrating a lack of respect to the patients who are waiting to be cared for and your colleagues who are waiting to go home. So whatever it takes, if you need to show up 2 days before your rotation and make sure you know how to get there, make sure you know where to park, make sure your badge works to get you in, do what you need to do to make sure you're there on time. Dr. Story mentioned everybody's standing around at sign out and a medical student walks in 5 minutes late. Everybody sees that, and it really is a killer. It may not be fair, things happen, but recognize that it really can put you down quite a bit. Okay, don't lie, right? And all of you are going to say, I don't lie, I would never lie. But again, this is an incredibly stressful experience. You know you're being evaluated at every turn. And in that moment when you go see a patient with a sore throat and you come back and you give a crisp presentation and your attending says, what'd their throat look like? And you realize you didn't look in their throat. All you're going to want to do is say, oh, it was kind of red and, it was, kind of, I don't know, normal-ish, right? So two things. We see this a lot. You won't get away with it, because we'll recognize it. We're going to repeat your exam, and so we'll find out the things that you maybe were not fully truthful about. And more importantly, it discredits your ability to be trusted for the rest of the rotation, right? So something that I absolutely love when I'm working with medical students and residents is I say, hey, did you look in that patient's throat? And they say, oh my gosh, I can't believe I forgot to do that. I'm going to go do that right now, right? That shows me that you're humble, that you're honest, and that I can trust you. It also opens the opportunity for me to teach you something, right? Because that physical exam component was important in that evaluation, and so we should really drive that home, and it opens opportunities for education. So you're going to say, I won't do it, but month after month we see this happen. So resist that temptation. Okay, don't be an asshole. This is simple advice, right? This is kind of what I learned in kindergarten, but this is critical, and this has come up a couple times. This is a quote from Sir Frederick Treves, who's credited as doing the first appendectomy. This is in a book that I read to my 5-year-old and 3-year-old son on a regular basis, which explains my parenting style. I'm going to read it to you. Don't swagger. The boy who swaggers like the man who swaggers has little else that he can do. He is a cheap jack crying his own paltry wares. It is the empty tin that rattles most. Remember that the hardest thing to acquire is the faculty of being unselfish. As a quality, it is one of the finest attributes of humanliness, right? So be humble. And this came up in the last couple talks, this idea that everyone with whom you interact during the month that you're rotating is evaluating you, right? Especially the clerkship coordinator, especially the clerkship director, your attendings, co-residents. We had a story last year at Cord of a student who took an Uber to the airport, was a complete jerk to his Uber driver, who happened to be the clerkship coordinator's husband, right? So that can happen, right? The 28 days that you're in the city for this rotation, you are on, okay? And ideally, you're good people and you're not a jerk at baseline, but if you are a jerk at baseline, find some way to stuff that down just for those couple weeks, right? Hide your personality disorder. Next up, don't break the rules. So this is something that came up time and time again. I think this is specific to who you're working with. But oftentimes at the beginning of a shift, a senior resident or a faculty member will lay down some ground rules, right? I want you to call me when you pick up a new patient. I want you to let me know if your patient has any abnormal vital signs. If you see an EKG, I want you to bring it to me within a handful of minutes, right? Those rules, as specific as they may be or as general as they may be, are being impressed upon you for reasons that are important to that person. So pay attention to that and try to follow that, right? I think the way this comes up oftentimes is, as medical students, we want to hit the ground and we want to say, I can do this job, right? I can run a zone. We would way rather you appropriately and carefully take care of 1 to 2 patients than to absolutely flounder taking care of 6, right? So know your limits, work within those limits, both imposed by you by your preceptors and your own limits of how you can function best, and really focus on providing that excellent care. And then I think this is the most important one, right? So oftentimes we see medical students who show up to a rotation and think, if I can ingratiate myself with this senior resident or this attending, that's going to get me a spot, right? So I know that this person is a cyclist, and I cycle, so I'm going to talk about cycling, and I'm going to buddy up at the nursing station and make sure that they remember me and that we have things in common, right? It's not really, it doesn't really work, right? And the thing that we all share in common is a desire to take excellent care of our patients. So the thing that you're going to do to impress everyone is not sit there and try to make connections one-on-one with these senior residents and attendings. It's to make connections with your patients. As medical students, you often have a little bit more time within the department, and so spend that time with your patient. Get a little bit more history. Keep them informed of their care plan. Make sure they're comfortable. And that's going to go such a long way in terms of how you're evaluated and how you're seen, and again, as a component of the SLO, right? That ability to show a compassionate and caring attitude. Okay, so that covers the don'ts. Those are the pitfalls that we commonly see, so you guys are all going to avoid those for sure. Let's talk a little bit about the do's. So do be enthusiastic, right? One of the things that recharges me and many people in medical education every year is our opportunity to work with medical students, right? You guys come into the department, you're excited, things are new, and that energy really elevates all of us. So don't steal that from us. And I think the way that this often comes up is in kind of the negative talk that can occur in an emergency department, right? So I don't ever agree with it, but it happens, right? We know this, the kind of patient bashing and this person's pain seeking or opioid seeking or this frequent flyer, and that'll happen, right? That's unfortunately a part of our job, and as much as we try to minimize it, it still exists. There's no role for you as a medical student to participate in that, right? It's something that we probably do in some way to manage the burnout that we may feel from day to day, but you guys are our shining light, and so shine. Be energetic, be enthusiastic, be excited about the fact that you're coming to work. Hopefully you are, right? This is going to be a career of yours for the next 30 plus years, so show up and work hard and be energetic. Okay. Perfect your presentations. I think it was really interesting. I've been involved with a handful of kind of emergency medicine interest group boot camps, and oftentimes they're procedurally focused, right? This idea that if I know how to sew a laceration or put in a central line, I'm going to excel on my clerkship. And in reality, you're rarely going to be evaluated for your ability to do a procedure. But every patient you see, you're going to be evaluated for how you present that patient. So if you spend any time in preparing for your clerkships, I think this is the place to make your, to spend your time and do your practice, right? Really make sure that your presentations are as crisp, as efficient, and as effective as possible, right? That means sticking to the script, right? You're going to present the history and then the physical. You're not going to bounce back and forth. Have an assessment, have a plan. There are a couple of resources that I've put up here that can be helpful in this. This rapid mnemonic can be helpful to contextualize a history and physical and formulation of an assessment and plan. And then the 3-minute emergency medicine medical student presentation is a paper that's a little bit dated but still effective in kind of refining those features that are so important to an effective emergency medicine presentation. Right, stick to the script, know everything, but only present the relevant information, right? I want to be able to ask you a question and you have that answer, but I don't need to know every detail of the patient's family history if it's not relevant to the case. You presenting what you think is relevant also frames your medical decision-making in my mind as you're presenting, right? And that's this idea of pertinent negatives. And this came up over and over again as I asked people what differentiates good students, and they said those students who are able to present the pertinent negatives as part of the history and physical exam. Right, so you see a patient with chest pain and you say they've never had a history of DVT or PE, they have no hemoptysis, they have no lower extremity swelling, they have no recent travel, right? And as you're presenting, I know that you've thought about PE and I know where it's going to land on your differential based on the information you're presenting to me. So this is the space to really spend your time practicing and refining these presentations. As a caveat to that, I would challenge you to get rid of the paper, right? So medical students, all of us are so attached to our notes that we don't want to forget a single detail. And that really takes away from your opportunity to connect with your patients and also connect with your preceptors, your senior residents and your faculty. So all of you are smart people. All of you care about medicine and emergency medicine. You should be able to have a 5-minute conversation with somebody about something that you care about and remember the details of that when you walk out of the room. And I promise you can all do it. It's just the crutch. If you have to have a note card in your pocket to write down some medications or vital signs, that's fine. But I challenge medical students on this all the time, and usually within an hour they feel like relief from getting rid of their notes. So I would push you to do that. A couple more things. Take initiative. Dr. Story mentioned this as well. You know, if you're going to do a procedure, do the work to understand what you need. Go find those supplies from the supply closet. Something that I always encourage our medical students to do in their first couple of rotations is spend some time in the supply room. Understand where things are. Be self-sufficient. This also puts you in a position where you're going to be able to do more and see more and learn more. An example I'll have with this is we have a handful of ultrasound machines in our department, and every sick trauma patient that comes in is called to a room, And a medical student grabbing that ultrasound machine and bringing it into that room may seem like scut work, but what it shows me is that you have situational awareness, you know what the needs in the department are at this moment. It also puts you as a medical student who just wheeled that ultrasound in a great place to participate in that resuscitation. And so you got to balance this a little bit and be willing to take that initiative. Commit, right? So one of the things that we like to see with our medical students in terms of assessment and plan is come up with a plan. And it could be the worst plan in the world, but our plan is better than no plan any day of the week. And what I would ask you to do is, as you're presenting a patient, think if I were the only medical provider who was going to take care of this patient, this is what I would do. And your answer may be, I'm going to do a pan MRI and admit them to the ICU. And that may be a horrible plan. But it gives us a place to start to understand what made you think that was a reasonable plan and how we can dissect this back. And so commit, commit, commit. And you can say, listen, I don't know what to do, but if I were the only person here, this is what I would do. So put your nickel down. Have a goal. So this was brought up a little bit before, but have a goal for your rotation, for your shifts, and share that goal with your faculty and senior residents, right? Come in and say, the thing I want to work on today is really being more efficient when I'm in the room with a patient and doing my history and physical exam. Right? That shows so many things. It shows a humility, it shows a coachability, and it shows a commitment to lifelong learning. And that's what we're looking for in residents, right? The medical knowledge is going to come. It's the ability for you to be teachable that really is something that's so important to us. So have a goal, share your goal. And then lastly, use your resources. There's tons of resources available through EMRA, through CORD, through SAEM, CDEM, and RAMS. Really dig into those, make sure that you understand how you can best perform on your rotations. A lot of these resources can be used as pocket references or on your smartphone during your shift. So really dig in, spend a little bit of time in preparing for your rotations to make sure you have the toolkit necessary to succeed. So that was a pretty quick run through. Just in summary again, our do's and don'ts for your rotations. Again, these things come up month and month and month and month again. So make sure that you guys don't fall prey to any of these. Thank you.